I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're going to talk about today is the adrenal glands. Now, if you've listened to our show before, I've discussed the adrenal glands, sometimes ad nauseum, because they're so important, and nobody seems to talk about them. And without them, our body doesn't function. We can't metabolize fat. Sex drive goes down. Our sex hormones go down. It can shorten your life. So it's such an important, they are two of them. They're such important organs, and nobody seems to worry about them. We talk about the heart and the lungs and the liver and the colon, but the adrenal glands are the control center for all of that. So that's why we got to make sure you understand what the adrenal glands are, what you're doing to mess them up, and then what we need to do to get them working right. So the adrenal glands are two glands. They sit on top of your kidneys, and they're about the size of a walnut. There's two separate areas, actually three areas, but the main one is the adrenal cortex, and that's the outer part of the gland, and that produces hormones that are vital for life. Things like cortisol, which helps regulate metabolism. It keeps your body responding to stress. And aldosterone, which helps control blood pressure. So the outer part is essential. The adrenal medulla, that's the inner part, produces what we call non-essential chemicals. When I say non-essential, you can live without them, but you wouldn't do well. Okay, so you need to get both parts working. So when you think about the adrenal glands, stress oftentimes comes to mind because I've told you that it's a big player in stress. And it's pretty important that you understand that because the adrenal glands are arguably best known for secreting something called adrenaline, which rapidly prepares your body to react to a stressful situation. So right now, wherever you are, if a gunshot went off, your adrenal glands would release adrenaline. Adrenaline would get into the body, open up the blood vessels. It would take blood away from your digestive system, which is at this point non-essential because you're worried about your life. It would pump blood into your muscles so you could run or fight. And so that's what the adrenal glands do. They manage your body's ability to deal with stress. But the adrenal glands contribute to your health even at times when your body isn't under stress. In fact, they release hormones that are so essential that without them, you'd be dead. So the adrenal glands, like I said, they sit on top of your kidneys. They're about the size of a walnut. I was going to go into all the hormones that they produce. Thought that might have been a bit much, so I kind of decided to skip that. It's the fight or flight syndrome. That's something that people talk about. Again, am I going to fight the thing that's attacking me or am I going to run away? So they control the nervous system, and the hormones contribute to this response. So there's epinephrine and norepinephrine. They're the hormones secreted by the adrenal glands. And the other things that they increase your blood sugar. So again, if the shot goes off behind you, the body's going to release blood sugar into the blood so the sugar can get into the cells, and the cells can utilize the sugar as fuel, and the cells are going to work real well, okay, to do their job. The big problem we have is when we continually stress our bodies. We're going to cover that in a little bit. So many times we're continually stressing our bodies, either chemically, physically, or emotionally. And the adrenal glands are saying, okay, I'm under attack, and it really can't distinguish between chemical, physical, and emotional stress. So if I have someone in my family die, probably the most stressful thing we can experience, according to Dr. Hans Selye, he's a researcher out of Canada, and he says the most stressful thing we experience is death of a loved one. The number two most stressful thing we experience is moving. So you could move to a new house, to a new job, to a new relationship. And so we are creatures of habit. We like things stable. And when things change, our bodies don't respond very well, okay? And, well, they respond. They can respond well, but if it's long term, that's when it causes the damage. So let's assume I have chronic pain. Okay, and as a chiropractor and a pain specialist and board certified in orthopedics and board certified in pain management, we see a lot of pain patients in our offices. And patients come in there in pain, and if the pain is chronic, it's been there for a long time, that puts a major stress on the body. So the body thinks it's under attack and is responding accordingly. Long-term stress like that can essentially burn out, as we say, the adrenal glands. The adrenal glands just can't keep the pace. And so we're going to talk about what to look for in adrenal fatigue and then the things you need to do to fix it. So I want to give you a little hormone terminology. You may have heard these words before and didn't know what they meant. And this is something that always bothers me. If I take a class, and even when I was young, I started playing football when I was in 8th grade. Well, I got out there and I was a big guy and they put me right on the line. I was an offensive and defensive tackle and I was big and I was strong. No one ever taught me the rules. So I remember one day we were in a game and I was playing offense and it was a pass play and I ran downfield and I got a penalty. Ineligible receiver illegible receiver downfield. I didn't even know what that meant because no one explained to me the basics. So that's why with these shows and these lectures that I do and the books I write, I try to explain it so that you know what we're talking about. And sometimes you don't even know the question to ask. So you may have heard the term anabolic steroid. These are hormones that stimulate growth, the bodybuilders in the rebuilding process. If I lift a weight, I damage my muscle, and then the body sends in anabolic steroids to rebuild it. And this is the principle that we're using now in anti-aging. Anti-aging medicine, and we have a medical doctor on staff who's an anti-aging specialist, and we'll do things like PRP. So what PRP is, if you have trauma to the body needs to heal. And if you don't have the cells that can do the healing process, the body doesn't heal properly. So trauma sometimes can be good. We can damage an area so that the body sends in new cells to heal. So we can do that with certain therapies. There's something called a TRT, which is a therapy that kind of sends electrical impulses into a joint or a muscle, damages it, and then the body sends in what we call stem cells to heal. With PRP, we're taking the growth factor out of your blood, the platelets, concentrating it, and then re-injecting it into a damaged area. So we're sending in cells that facilitate healing from within. So it's your own body cells doing the healing. And that's why we do PRP in our offices, because it's the body's own response. We're not doing drugs. We're not doing surgery. We're doing the body's own response. And for arthritis, especially knee arthritis, shoulder arthritis, muscle damage, tennis elbow, wrist issues, carpal tunnel syndrome, PRP is shown to be stellar in most cases, not all, in most cases to get amazing results without drugs and surgery. So that's why we like to use things like PRP. We use nutrition, we use chiropractic care. So we want to get the body to heal itself and not use external means to get the body to work. So anabolic steroids are hormones that cause the body to grow. Androgens, these are traditionally called like male sex hormones. Now the androgens, men and women both have androgens in their body, and they help with overall health, energy, vitality, growth, development, mood, emotion, cognitive function, immune function, red blood cell development, muscle and bone strength, and protection against degenerative diseases. So these traditional male hormones also produced through the adrenal glands, and so they're really important, but men and women both have them. And if the adrenal glands aren't working, you may not be producing the right amount of hormones for the body to heal. There's also a term you may have heard called bioidentical hormones. Bioidentical hormones are plant-based hormones that are chemically and structurally the same as human hormones. Now, in the case of male and female hormones, a chemist or a pharmacist can compound plant sterols, they're called, from things like wild yam or soy into bioidentical estrogen, progesterone, testosterone, DHEA. And in our office, we can do blood work on you to test your hormone levels. And if you are low in hormones, we can give you a plant-based version of these bioidentical hormones to try to get your hormone levels back to normal again. Sometimes the body just needs a reboot. The body isn't working, there's a short circuit somewhere along the line, and chiropractic care can put the bones back in place. Nutritionally, we can give you certain foods for certain organs. There are certain supplements specifically for the adrenals. We have Dr. Joe's Adrenal Support Supplement. I take it every day. Because again, if you're over 30, if you're over 40, you have stress in your life, chances are the adrenal glands are being stressed. We can nourish them specifically. And so I take Dr. Joe's Adrenal Support as one of my supplements that I take every single day. So we got to get the body right. And if we do a bioidentical hormone, it's a plant-based version that sometimes can jumpstart the organs and get them working properly again. We do that in our offices, and it's really powerful. We can test your hormones. We can try to balance them out, retest, see where we are, do nutrition as well. And that's what makes us different than most other offices. Many other offices might just give you hormones, but they don't give you the nutrition. They don't give you the chiropractic. They don't give you the supplement support to get the body working again. I don't want you taking hormones forever if you don't have to. I want to get it so we can just jumpstart it and get it working naturally on its own. There's something, again, we're talking about hormone therapy, hormone terminology now, so you understand as I talk further what I'm talking about. Cell receptors, these are little places in the cell that they can absorb nutrients or absorb a hormone and then be activated. So a hormone may go to a cell at a cell receptor and activate it. Hormones, of course, these are biological chemicals produced by glands in your body. Very small amounts of hormones we use in a lifetime, but they're so powerful. And that's why even just being a little bit off can cause a major impact on your overall health. And you can upregulate hormone production. What that means is I don't have enough, so my body's going to upregulate and make more. You can also downregulate a hormone. What happens is, if I have too much of a hormone, my pituitary gland or one of the glands in my hypothalamus pituitary gland will send a message and say, okay, we have too much of that hormone, stop producing it. So this is what we call a negative feedback system. My body needs thyroid hormones. My thyroid levels start to go low. My brain produces thyroid-stimulating hormone, goes into the thyroid gland, makes me produce hormones. Then I have enough hormones, it goes back into my brain, and the brain says, okay, we have enough thyroid hormone, stop the production. This is going on all day, every day in your body. When that feedback mechanism goes out of whack, that's when you start to have problems. And so you got to make sure you understand that the hormone system, very little bit is used in the body, but it controls just about everything. Because then the thyroid gland produces thyroid hormones control metabolism, body temperature, hair growth, skin structure. So we have to have all these chemical reactions happening all at once. And it seems like the more we study, the more we find these hormones are controlling everything. And so we mess with the hormones every single day. And I'm going to talk about the things that you're doing every single day to mess with the hormones. There's also, last thing, steroid hormones. These are made from cholesterol. So one of the situations I like to talk about with patients is if you're on a cholesterol medication, it slows down your body's production of cholesterol to lower your cholesterol level. But you need cholesterol to make things like steroid hormones and to make sex hormones and to make cell walls and to make everything work. So we've got to be careful not to just willy-nilly say, I'm going to lower my cholesterol. That's great. What about the function that cholesterol does? You know, cholesterol is good. You need it to live. And so if you have high cholesterol, we've done a great show on it. I want to go into cholesterol. I started to go off on a tangent there. Go to our website, drjoe.com, drjoe.com, and type in cholesterol. We did a really good show on cholesterol, and you could listen to that. We talk about highs, lows, what it means. Sometimes you don't have high cholesterol. You're just not recycling the old cholesterol, which then gives you high cholesterol. So you're not producing too much, you're not recycling the old. And then we talk about in that show what to do to kind of clean out the recycling bin to get the cholesterol being recycled. So hormones can be a little tricky, and I don't want to overburden you with too much information here because your brain will explode. But I want to get you to understand that it's not something you want to mess with, and most of us are messing with it every single day. We're doing things, which we'll talk about. We're eating foods that are high in estrogen-like compounds, commercial meats, high in estrogen-like compounds. There's something called endocrine disrupting chemicals or hormones. I was in a grocery store the other day with a family member, and she said, what are parabens and phthalates? And I thought, what a strange question for a teenager. And I said, well, parabens and phthalates are chemicals that act like estrogen, and when they get into the body, they mess with your hormones. And I said, why do you ask? And she said, well, this bottle of soap says no parabens or phthalates. I said, okay, so if you're going to do a soap, that's a better choice. Now, I'd rather you do Castile soap, which is my personal favorite, but this was a commercial soap, and I said, that's a better choice. Because parabens and phthalates, we put them in these soaps and shampoos and conditioners, and they made it creamier, they made it softer, they made it work more effectively. But the problem was it was messing with the hormones. So now, crazy people like me have caused a movement to say you got to get these parabens and phthalates, bisphenol A, get it out of our food supply and out of our chemical supply. And it worked because you're starting to see this on labels now. So now it's bragging rights. People are showing it as a badge of honor. Look, I don't have parabens and phthalates. Good. That's great. Still a lot of chemicals in these things, but the parabens and the phthalates are the ones that get in the body and act like estrogen. Estrogen is a growth hormone. It causes growth. Many cancers are stimulated by too much estrogen. Estrogen in large amounts cause you to lay down fat. Fat, in turn, becomes a living, breathing organ and starts producing estrogen. So estrogen produces fat, fat produces estrogen, and this is why women have a harder time to lose weight than men in most cases because women are what we call estrogen dominant. They have more estrogen than men. And so if we can take these things out of our lives, these endocrine disrupting chemicals, we're going to take the stress off our hormone system and the body's going to work more efficiently. So we did a show a while on household chemicals. You might want to listen to that show. We've done shows on male health and female health. In fact, we did 2 shows on female health. Now we have a show on adrenal support. So you might want to listen to these shows if you're concerned about your hormones. And who should be concerned about their hormones? Everybody. So I want to talk about some of the hormones. The big one, the granddaddy of the whole system is called pregnenolone. Pregnenolone is a steroid hormone manufactured in the body, and it's the precursor of other hormones, which means we start with pregnenolone, it becomes DHEA. DHEA, if you're functioning normally, becomes your sex hormones, testosterone, estrogen, progesterone. If you're under stress, pregnenolone becomes DHEA. DHEA then becomes cortisol. And cortisol is the stress hormone. Now, in a perfect world, your cortisol levels are high in the morning, they wake you up. Stress hormone, right? Wakes you up and it drops as the day goes on. That's normal cortisol function. So we can check your adrenal function by testing your cortisol function. We could do that in our offices. And as long as it starts out high and drops low, chances are your adrenals are in pretty good shape. There's other tests too, but that's the big one. If you test your cortisol level and it stays high throughout the day, you're under constant stress. Then you have to sit down with my doctors and say, okay, what is it? Is it chemical stress? Is it physical stress? Is it emotional stress? And then we have to get in there and fix that so that your cortisol goes through its natural cycle. So again, pregnenolone is synthesized from cholesterol. Once again, we need that cholesterol, principally in the adrenal glands, but it's also made in the liver, the skin, the brain, the testicles, the ovaries, the retina of the eyes. So it's not just the adrenal glands that make these things. And that's what's cool about the body, is that the body usually has a backup system. You have 2 lungs, you have 2 kidneys. The only thing I can't figure out, and this is a rhetorical statement, of course, is why we only have 1 heart. I would think that we should have 2 hearts, at least 2, because if one fails, we have a backup, like so many other things in the body. We have left and right side of the brain. So we usually have 2 of everything. We only have 1 heart, though, and that's the thing that kind of fascinates me. So they make steroids. It's a steroid hormone. Steroids are a large family of structurally similar biochemicals that have sex-determining, anti-inflammatory, growth-regulating roles. So pregnenolone is the grand precursor which most of these steroid hormones are made, including something called DHEA. Again, pregnenolone becomes DHEA. DHEA then becomes testosterone, progesterone, estrogen, or if you're under stress, it becomes cortisol. So pregnenolone, it's important you understand this, has been found to be 100 times more effective for memory enhancement than other steroids or steroid precursors in laboratory mice. So if you've never heard the word pregnenolone, you need to know it. That's why you listen to these shows, to get new information. Pregnenolone appears to be the most potent memory enhancer ever reported. Pregnenolone has been reported not only to make people smarter, but happier and enhance one's ability to perform their job while heightening feelings of well-being. Pregnenolone has also been reported to reduce feelings of stress and also help with fatigue. So once again, we got to go, okay, where's the pregnenolone coming from? Coming from the adrenal glands. I'm going to go through all the things you're doing real soon. If we don't get it in this first segment of the show, we're going to cover it in the second segment about what we need to do when it comes to stress. What you're doing to stress out your adrenal glands, to raise your cortisol levels, to affect your pregnenolone function, which is going to affect all your hormones, including your energy, weight loss, sex drive, sex function, blood vessel, blood pressure. All these things are going to be affected by pregnenolone or lack of pregnenolone. So in the case with the steroid hormone, again, pregnenolone comes DHEA, pregnenolone levels decline with age. Now, we have supplements on our website, drjoe.com. One of them is the male hormone support. The other one's a female hormone support. And what it is, it's DHEA. So the DHEA, pregnenolone becomes DHEA. DHEA then can become your sex hormones. If as your production drops, sometimes we need to supplement. I take the male hormone hormone balancer every single day. Okay, because it's something I want to make sure I have enough DHEA, because DHEA becomes so many different things. And no matter how well you take care of yourself, we're going to get older. The body is going to start to function in different ways. It's not going to produce like it used to. But the cool part is with anti-aging medicine, My doctors and I have ways to kind of beat the clock, so to speak, and help keep you younger. And that's the goal, isn't it? I mean, whoever stays the youngest, longest wins. And we can externally look good. We can have plastic surgery. We can do all sorts of things to look good externally, but we also want to be healthy internally. And that's what we're talking about here with the adrenal glands. So hopefully this isn't getting too overwhelming for you. If it is, and you need to listen to this show again, it's going to be on our website, drjoe.com. And by the way, the supplements I talk about, the hormone regulators, we're going to talk about, of course, the minimum supplements everybody should be taking. Super Green's an essential source. Vitamin D, especially in the winter, vital for immune system. I can't imagine anybody not taking vitamin D. All these supplements are on our website, drjoe.com, and you can pick them up in our offices too. Save shipping. We have offices in Marietta, Duluth, Stockbridge, and West Cobb, and we offer chiropractic care, nutrition evaluations, digestive work, anti-aging, DHEA functioning, again, kidney functioning, PRP, which is rejuvenating, taking your healing cells out of your own body and concentrating and putting them back in. Facials, we can do with PRP, we can actually do a natural facial. Hair growth. Can stimulate hair growth. And if you're totally bald, it's not going to be the thing for you. But if you have spotty spots of hair loss, PRP seems to work really well for that as well. Hormone balancing. And on our website, drjoe.com, if you look under services, we have a list of all the services that we offer. And you could look at it. If you have any questions, you could always call us or send us email through the website. More than happy to work with you. So pregnenolone, again, works with the brain. It helps the brain and memory function. So many times as we get older, of course, memory isn't what it used to be. It could be because the adrenal glands aren't producing pregnenolone because you've stressed out your adrenal glands. And I'm going to cover that in just a second on the things that you're doing to stress out your adrenal glands. And most of us are. Chemical, physical, and emotional stress. And that's why with physical stress, chiropractic care is by far the most effective, least expensive treatment for pain. So if you have pain, probably want to come see us. So by age 75, our body produces 60% less pregnenolone than it did from our mid-30s. That's a big drop. For this reason, pregnenolone is one of the biomarkers of aging. We can measure your pregnenolone levels and kind of determine chronologically how old you really are. It's kind of like counting the rings in a tree. If you can measure the pregnenolone at any given point in a person's life, and it's often possible to make an educated guess at their age. Now, my goal would be that we fool everybody. And that's what I want to teach you guys. I want to teach you how to get well and stay well. I want to teach you that there's so many things in healthcare you've never even heard of. PRP, perhaps. PRP for hair growth, for facials. Erectile dysfunction. Even PRP is working now for erectile dysfunction. Women, juvenile revagination. Revagination of the vagina to get the muscle stronger again. Urinary leaks. So there's so many things that we can do naturally to get you well and keep you well. So if you have a health issue, neck pain, back pain, shoulder pain, headaches, numbness, tingling, you're concerned about aging, hormone issues, digestive issues, acid reflux, my team of doctors and I would love to be your doctors. So we have offices in Marietta, Duluth, Stockbridge, and West Cobb. So if you want to make an appointment, go to our website, drjoe.com, and we can set you up a time. The initial visit for chiropractic used to be $375. Through COVID, we've dropped that price to $149. And that includes an exam, x-rays, consultation with me or one of my other doctors. X-rays, I did say x-rays, right? First treatment, going over the x-rays on the following visit, and doing a nutritional evaluation with you. And that's $149. You're probably going to need more care. In fact, very seldom I've ever met a patient who doesn't need further care. We accept most insurances for further care. And if you've ever been in a car accident, if the car was damaged, you were damaged 100% of the time. So as soon as you know somebody who's been in an accident, get them in here. Every day, patients say, Dr. Joe, I hear you talk about if the car was damaged, you were damaged. My friend was in an accident. I'm begging him to come see us. Have him call me if we need to. You got to get in here, folks. Nothing could be more detrimental to your health than not taking care of it. Again, if you want to make an appointment, drjoe.com. I'm Dr. Joe Esposito. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.